As you probably know, this is our 19th annual employment seminar. It's hard to believe. We are hoping that next year for 20, we will be out in the community somewhere and can interact with you in face-to-face. We had hoped that for this year, but it didn't turn out that way. So here we go with my portion. We're starting with the rapid fire recent developments. And I'm going to be talking about leave issues. And just to our controller over there, we're going to minimize this screen for me. I don't know about the rest of you, but I can't stand staring at myself while I'm doing a presentation. All right, so my subject for my rapid fire update is leave issues. And we are going to be talking about leave in different contexts today, including the legislation and also certainly under the whole COVID section. So I tried to find some topics that were not either of those. And what I came back to is my old friend, the FMLA, because you know we love the FMLA, and I don't want it to get lost in all the discussion about COVID and accommodation and all that other stuff. So I wanted to talk about two things FMLA related, and one of them is timely in the sense that it deals with holidays. So we've got a bunch of them coming up, and for those of you who have people out on FMLA, I want to be sure you're administering and counting that time correctly. So here's just one short tip. If you have, let's say somebody's out on a long-term FMLA, so they're out on, let's say, the whole 3 months, and it's not intermittent. If they are out for the entire work week and the work week has a holiday occurring within it, then you count that entire work week as 1 week of FMLA leave, okay? You don't back out the holiday, you count the entire week as a week of FMLA. So that's the easy scenario. The more difficult scenario is what happens when an employee is on intermittent FMLA and a holiday occurs in the middle or at some point during that week. And so the question is, do you get to count that day as an FMLA day? And if so, how much does that count toward the person's leave calculation? Because that makes a big deal in the end. You don't want to shortchange somebody FMLA time because that's a certain way to end up with a claim. So if the employee is only working a part of a week, but they do work at least a day or some part of it, then you do not count the entire work week, of course, as FMLA, and you would not count the holiday. So if an employee works 3 days a week, and then the fourth, well, like how many days are there? There are 5 days a week, right? All right, so let's say they work 4 days of the week, and the holiday occurs on the 5th day. Then the issue is, how many of those days are you counting? Obviously, you're only counting the days that they actually work, but how much does it count toward the FMLA? So the DOL has not specifically answered this question in the regulations, but the insinuation and some indications that they've been given is that you would not calculate it based on a 5-day work week. You would calculate it based on a 4-day work week. So when you're computing the percentage of FMLA leave, you are computing it on a 4-day work week, okay? So you're not counting that holiday in there at all. All right, and if that didn't make sense, or if you have questions about anything else, please shoot them to us. We cannot see them as we're going along, at least at this point in the presentation, but we are maintaining them in some fashion, and we're going to come back to them at the end of our sort of lengthy session after the last break. So we will get to your questions, and so feel free to let us know what they are. So the second FMLA issue does have something to do with COVID and this whole idea about remote workers, because that concept does not appear to be going away anytime soon. And the question is, though, how do you administer and how do you count, or how do you even apply the FMLA when now some or all of your workforce is not working in the office? And what I mean by that is, how do you determine whether to count those people at all anymore, and do you have to count them? So, so this is really important because state and federal say different things about this. Because as you know, there's different requirements for when each of them apply. So state law only applies when you have 15 or more employees in one location in the state, okay? But federal applies when you have 50 or more within a 75-mile radius. So you can have more than one site, and as long as they add up to 50 between those sites and the sites are within 75 miles of each other, then you are covered. So what happens when half your workforce has taken off for Florida or somewhere warm or somewhere outside of Maine to work remotely from their RV? Because you're not counting them in that state, although that raises a whole different issue about whether or not leave laws in the state they're in now apply to them. But for purposes of Maine, you can't just simply discount them by saying, well, they're working out of their RV and therefore they're not at my location and therefore they don't count anymore. What the DOL says, this is federal, not Maine, but I would say you could apply the same law to Maine. Federal says that you're not looking at where they're located when they're remote, or on a job assignment or somewhere else. You're looking at where is their primary work location and where are their assignments coming from. So if you still have an office in Maine and you are administering or sending out assignments or dealing with employees from that office, as long as you still have the requisite number of people, they are still going to be covered by the FMLA. So as an example, so state, remember, is 15 or more at one location in the state. So if you're sitting here in Bangor and you no longer have 15 bodies in your office, because they have gone remote, and before COVID you had 35 employees, and now let's say you have 10 sitting in your office and 25 are in sites unknown around the world, as long as you are still assigning work and they are reporting back to you in your office, all of those other 25 people still count. So you are still going to be covered by the Maine FMLA, okay? And the same is true of federal. So I just want to be sure people don't think that just because employees have physically vacated the premises, that means that you're now free to no longer apply the FMLA. So it doesn't work that way. The other thing about this sort of COVID situation that's raised FMLA issues is whether or not something counts as a serious health condition. So I don't want employers to just jump to an assumption that anybody who's out because of COVID is automatically covered by FMLA and start running that time concurrently. Because even though it's leave, you can't forget that the FMLA requires somebody to have a serious health condition or they're needed to care for somebody with a serious health condition. In a lot of cases, ordinary symptoms of ordinary COVID don't rise to the level of a serious health condition. They might, but they don't always. So you need to make sure you're making that assessment before you just randomly start the FMLA running. And it's because it's not triggered just by the fact that they're out. It's still you still have to apply the rules. Now, needed to care for is different, because if they are caring for a family member with COVID, then that may very well meet the definition. In fact, it probably does. And so then their FMLA may apply under that category instead. The one thing I will say about this, though, is that we are now seeing what they're calling the long haul cases, right? So these are people who had COVID and now the symptoms, they appear to morph into something different and in some cases more severe than the actual COVID. And so those cases might actually turn into serious health conditions. So you need to monitor if people are out and all of a sudden they start reporting, I need to be out longer, or the symptoms have changed, or the situation is more serious. You may need to do a recertification or an initial certification to see if they are now covered by FMLA because their condition has now become a serious health condition. All right, so don't forget about that. Also, just as an aside, long haul symptoms can certainly also be disabilities under the ADA and the Maine Human Rights Act. And we have seen cases where the ordinary COVID symptoms were not, but once it turned into the long haul, people became much more incapacitated and it did count. And then the last thing about the COVID stuff is they have reinterpreted the FMLA in terms of what kind of doctor's visits are required for the FMLA to apply. And now they have, they, meaning the DOL, has recognized that remote visits to physicians or healthcare providers of any kind count under the FMLA. So the employee does not have to be able to visit that doctor or the healthcare provider physically in person. These remote visits now count in terms of the determination of whether or not somebody has a serious health condition. And I don't see that changing anytime soon, because it seems like that system is working well for a lot of people. And in fact, it may even make it easier for you to get the certifications if the doctors can see them faster because they're remote visits and being done by telemedicine instead. But you do still need the completed certification. So even though the employee is not going to the office in person, they do still need to have that certification completed by the physician in their office. And then the last thing I wanted to raise is don't forget that the EPL is still out there in terms of sort of unrelated leave issues. Random leave issues is what I'm calling them. Because with everything else going on, and I know a lot of you have been amending your handbooks to talk about some of the new legislation, some of the new leave issues. In doing that, do not forget that when you have people out on leave or requesting leave, you have got to apply this EPL. Now, we're almost a year into it being applicable. What I'm finding is that a lot of employers, by no fault of their own, are just simply forgetting that this was out there, and that not only are you needing to track I hope all of you know what I'm saying when I say EPL. I'm talking about the Earned Paid Leave Law that went into effect last January. It's necessary that you track that time, but also remember to apply it. So if somebody wants to go out because they have a family member and they want to protect them from possible COVID exposure, even though they're not sick themselves, and even though they don't have COVID themselves, or they haven't been advised to quarantine, that may be a very good opportunity for someone to use their EPL. Remember that it is not specific to medical conditions. It covers leave for any reason the employee wants to take leave. And the only difference in the kind of the reason for the leave they're taking is in the notice that the employee has to give you. So for a emergency situation, it's essentially notice as soon as they can or as soon as practical. For leave for all other reasons, you can ask for a reasonable time, which is sort of a general guideline they've given us is around 4 weeks is even reasonable to ask for someone to schedule that time off. And so now we're coming to the end of the year. Hopefully your policy has already addressed what happens at the end of the year in terms of turnover of that time or carryover of that time, and you're prepared for that situation. If it doesn't, and if your policy doesn't address this at all, and if you have no idea what I'm talking about, either please let us know so we can help you out with that, or find out, because it's imperative that you apply these.